let's talk about IV fluids, specifically tonicity of IV fluids. So you have three basic categories of tonicity of IV fluids. We have our isotonic fluids, our hypotonic fluids, and our hypertonic fluids. This is normal saline, or 0.9% sodium chloride. I want you to think about 0.9% being the baseline for the percentage of solutes within an IV fluid. So any IV fluid that has a solute concentration higher than 0.9%, we will say it's hypertonic. Any IV fluid that has a concentration of solutes less than 0.9%, we will call it hypotonic. So, talking about isotonic solutions, our biggest examples are normal saline, which is 0.9% sodium chloride, and lactated ringers. These types of IV fluids don't cause any movement of water. The cell size remains the same. Fluid doesn't shift in or out of the intravascular space because the fluid is isotonic. It is equal to the solute concentration that's in your blood. So, hypotonic solutions. So remember, our percentage of solutes, that's our baseline, is going to be 0.9%. So this is an example of a hypotonic solution. It is 0.45% sodium chloride. You can also have 0.225% sodium chloride, which would be quarter normal saline. Both hypotonic solutions. So now think about the concentration of solutes in a hypotonic solution. It is less than that of what is in the blood. So now we're essentially diluting out the serum osmolality. We're causing the serum osmolality to go down. So now the cells have higher osmotic pressure than the blood. So water will flow where the osmotic pressure is higher. So water is now going to leave, or fluid is now going to leave the vascular space and enter the cell. Okay, so when we give a hypotonic solution, like half normal saline or quarter normal saline, remember that the cells are going to swell like a hippo. Also remember, we never, ever give hypotonic solutions to patients with potential increased intracranial pressure. Why? Because when we give a hypotonic solution, the cells are going to swell, further worsening any cerebral edema that patient may have. So we always give hypertonic solutions to patients with traumatic brain injuries with potential cerebral edema and increased intracranial pressure. Finally, we have our hypertonic solutions. So remember, these solutions are going to have a solute concentration greater than 0.9%. So 3% sodium chloride, 3% normal saline, also D10W or dextrose 10% in water. These are both hypertonic solutions. So what's going to happen to fluid when we infuse a hypertonic solution? Well, we're now increasing the osmotic pressure within the vascular space, okay? So the increased osmotic pressure in the vascular space is going to pull fluid from the cells into the vascular space, okay? So a big thing with hypertonic solutions is we've got to really watch these patients for fluid volume overload, because we're causing the patients now to have fluid shifts from the cell into the intravascular space. So you really want to make sure you're listening to lung sounds, making sure there's no new crackles, making sure we're doing those daily weights and eyes and O's when a patient is on hypertonic solution especially for an extended period of time. So that kind of sums up isotonic, hypotonic, and hypertonic solutions, and I hope this video has helped you guys.